American Health Journal, bringing you the latest information on medicine, psychology, diagnosis, treatment, and prevention. Major medical advances are made each week, and each week the American Health Journal keeps you up to date.
First up, we have a two-part report that explains an effective 15-minute breathing technique that relieves stress and improves heart health. Now on the American Health Journal. It's estimated that 75% of visits to primary care physicians are due to stress-related disorders, and among those is heart disease. In this two-part report, we spoke with cardiologist Dr. John Kennedy, who explains that stress directly affects the heart. Dr. Kennedy's written a book, The 15-Minute Heart Cure, that details this connection and tells how his 15-minute breathe technique can reduce stress.
Stress comes in two varieties. It's either acute or sudden in onset, like the stress you would experience in an earthquake or a natural disaster or a car accident. Or it comes in sort of day in, day out indolent stress, like the stress you might experience in the workplace or in a difficult relationship. But regardless of the stressor, whether it's acute or chronic, the fight or flight response is triggered, which releases these hormones, adrenaline and cortisol. And this causes a cascade of physiologic changes like increase in heart rate, increase in blood pressure. It causes our blood to become thick and sticky. It also increases inflammation. And in addition, stress causes changes in our body's blood sugar metabolism and our lipid metabolism. And all of these physiologic changes create the perfect storm for a cardiovascular event. And in addition to the direct toxic effects of stress, stress also causes indirect negative effects on our cardiovascular health. When we're stressed and we ignore the signs of stress, we tend to exercise less. We tend to eat poorly. We grab for comfort foods. And we also tend to smoke and drink and use drugs to mask the signs of stress. And all of these things further increase our risk of a cardiovascular event. Similar to stress and heart disease, there's an equally impressive and robust body of literature showing how relaxation therapy actually protects our heart. When you train people with known heart disease relaxation techniques, you can decrease their cardiovascular risk. You can lower their chances of angina and chest pain. You can decrease their chances of requiring coronary bypass surgery and decrease their need for repeat hospitalizations for angioplasty and stenting.
Dr. Kennedy told us about the benefits from using this technique.
There are numerous studies now showing how relaxation therapies decrease our cardiovascular risk. There's data with yoga and Tai Chi, breath work, and guided imagery, all show how these techniques lower our heart rate, lower our blood pressure, and decrease inflammation, which decreases our cardiovascular risk. And in all of these cases, we stimulate what's called the relaxation response, which is the opposite of the stress response. If stress causes our heart rate to soar and our blood pressure to rise and inflammation to go up, then relaxation does the opposite. It causes our heart rate to go down, it causes our blood pressure to fall, and it decreases inflammation. And stimulating this relaxation response is the key. But when you review the literature on all this data, you realize that simple stress-relieving tools that are self-directed and easy to learn are few and far between, which is why I created the breathe technique.
We asked Dr. Kennedy to explain his breathe technique.
In my technique called Breathe, which is in my book, The 15-Minute Heart Cure, I describe a 7-step, easy-to-learn relaxation technique that combines two proven forms of relaxation therapy, guided imagery and breath work. And Breathe is an acronym where each letter stands for a different step in the 7-step relaxation technique. B, begin, R, relax, E, envision, A, apply, T, treat, H, heal, and E, end. Breathing is what connects our heart and our brain. And so when you practice this technique, it's like in training or developing this neural network between your heart and your brain, just like toning your muscles in the gym. And the more you practice, the better you get at this skill, and the more likely you can call on this skill when you're faced with one of life's unexpected challenges, and you can stop stress in its tracks.
When we return, Dr. Kennedy will give us the 15-minute breathe technique. We return now with Dr. John Kennedy to learn how we can reduce stress with his 15-minute breathe technique.
Breathe is the relaxation tool that I describe in my book, The 15-Minute Heart Cure. The breathe technique has broad applications, and it's been used effectively to help heart patients optimize their cardiovascular health, to help kids focus and perform well in academics, to help patients relax before surgery, and to help companies help their employees reduce stress in the workplace. Every effective exercise has a formal beginning and ending. So when you do the breathe technique, you want to start in the same place every time. That's the B, that's the begin. I do my breathe technique at the scrub sink before I do my operations, and I go through the exact same thing every time, and anyone can do it. So when my patients tell me they don't have time to do it, I'm a cardiologist and I do it every day, and it really helps you execute and focus. R is the second letter in breathe, stands for relax. You want to take 7 deep breaths in through your nose, out through your mouth. You want to extend your exhalation because that's what stimulates the relaxation response, the opposite of the stress response. E is the next step in breathe, is for envision. You want to visualize your task at hand. For me, it's my surgery. For you, it may be getting 20 emails done at work or emptying your truck on a loading dock. E is for envision. A is for apply. You want to imagine how you're going to apply this technique during your workday when you get stressed. And it's very important for you to get in touch with what you feel when you get stressed. Stress is very subjective. What's stressful for me may not be stressful for you, but you need to get in touch with what you feel. When the stress response is triggered, we all feel something, either a knot in our stomach, dry mouth, sweaty palms, or a jittery pulse. That's what you need to get in touch with. That's how you apply the breathe technique, and you take a few deep breaths and you exhale, and you recall these images that you envisioned in the breathe technique. T is for treat. This should be, you should look forward to this exercise, like going to the gym and getting runner's high. You should look at this as a pleasurable experience, not as a duty or a chore, but something that's a treatment to you, almost like going to the spa to relax. And some of my patients tell me that even after their first time using it, they look forward to it because they feel so good when they use it. H is for heal. When you do this exercise, when you learn to focus and relax and become present, this is a healing exercise. We can show that you lower your heart rate and lower your blood pressure and decrease inflammation. This exercise is healing. And E is for end. As you end your exercise, you want to recall and summarize all the significance of your exercise and stop, open your eyes if you're closing your eyes, or focus on your day ahead. This is what I tell my patients. Know your triggers. Listen to the conversation between your heart and brain. Practice breathe. Focus. Use the part of your brain developed in breathe. Choose to respond to stress productively. Stay in the present. Be grateful. Love your family, your friends, and your support groups. These simple tips will help you weather any storm, real or emotional. The breathe technique is a very simple, easy to learn, self-directed relaxation technique that can help people relax, focus, and protect their heart all at the same time.